Pain management is an integral part of the management of IC-BPS patients. Because of the pain is the main presenting feature or the symptom, you can say, when they come to a urologist or a gynecologist, and the diagnosis is always delayed because of that, because they are always into a hierarchy of investigations, and then the diagnosis is delayed. So once the diagnosis has been established, the pain management at every tier of the management of whatever the urologists are doing, whether it is instillation, whether it is cystoscopies or whatever they are doing, the management of the pain is an integral part. How we can start? To begin with, when the patient comes, we have to know what is the intensity of the pain. We ask the patient. History and clinical examination is very important. Based on that, the management is based. So if the intensity of patient is high, it is, when we high means or severe, it means that patient says that it's on a score of 10, if it is more than 7 or 6, so it's a moderate to severe kind of pain. And we ask the character of the pain. Depending on that, we give them the medications. Along with the medications, we are always look for any pelvic floor muscle spasm, pelvic floor dysfunction. We also see for any myofascial bands, and if we find any which add to the pain of the patient, then we always prescribe them. We send then those patients to physical therapist for relaxation of the pelvic floor. Very important thing is that we always write on a prescription, being a doctor and whosoever it is, when we write pelvic floor muscle exercises, it undoubtedly or default it means that it is contraction, so which is always contraindicated. We have to write on our prescription along with the medications pelvic floor relaxation exercises, so the therapist understands that he doesn't have to give the pelvic floor strengthening exercises, because that increases the spasm and we are increasing the pain. So that will get the patients relieved of the spasm. With that, there are some physical modalities which can be used. The most important and the most commonly used, you can write on your prescription TENS, which is trans-electrical neural stimulation. So with that, again the pain is relieved along with the oral medications. With the first history and examination, we also have to ask about the stress in the life of the patient, because when the pain becomes chronic, it becomes a disease in itself, and that causes a lot to the mental psyche of the patient. So we have to deal with that also. When we ask them, any kind of stress increases the pain, they always say yes, and there's always a past history of any stress. If there are some intervention, minimally invasive intervention injection procedures which can be offered to the patient in terms of myofascial blocks, that is releasing the muscle spasm by giving them local muscle injections that can be blind or that can be ultrasound guided, depends on your skill. Then we can also offer them nerve blocks, like if they have a typical type of a perineal pain radiating to the vagina or to the anus, we can go for a pudendal nerve block. And when it is a generalized pain, because we know that it starts with bladder but it involves the pelvis, so we can go for sympathetic blocks, which is again ultrasound guided.